Men, have you ever wondered what happens when you go a long time without sex? Does your body change? Do you feel different? Some men have abstained for decades, and monks often commit to celibacy for life. But how does abstinence impact your sperm, testosterone, prostate, and even your energy levels? Let's break it all down with science. First, let's clarify something. Your sperm doesn't just sit there forever. Sperm is produced in the testes and stored in the epididymis. If you don't ejaculate, your body naturally reabsorbs old sperm through a process called spermatophagy. This happens in all men, including those who have had a vasectomy, where sperm is still produced but eventually broken down and reabsorbed. Semen, on the other hand, continues to be produced, waiting for stimulation to release it. Essentially, your body has a built-in recycling system for sperm. Does abstinence affect penis size? For the most part, no. However, the principle of use it or lose it does apply to some extent. Just like muscles can shrink from lack of use, long-term abstinence may slightly reduce erectile function due to decreased blood flow and lower stimulation, but this would take decades of complete inactivity to notice a real difference. Factors like aging and weight gain have a far greater impact on size than abstinence alone. If you go a long time without sex and then finally have it again, you may find that your body reacts more quickly than expected. This is because the nervous system becomes more sensitive after a long period of inactivity. The good news, it's temporary. Your body will readjust with regular sexual activity. One of the most debated topics is testosterone. Some studies suggest short-term abstinence, like 3 to 7 days, may cause a slight increase in testosterone levels, but longer periods don't necessarily maintain that boost. Other research suggests that a lack of sexual stimulation may actually decrease testosterone over time. However, the effect is generally not significant. Beyond testosterone, there are two key hormones linked to sex: oxytocin and dopamine. While there's no strong evidence that sex itself lowers energy, some studies suggest that ejaculation can temporarily reduce testosterone levels for a few hours, which may slightly affect aggression and drive. However, regular sexual activity is also linked to better sleep quality due to the release of prolactin and reduction of cortisol, the stress hormone, which ultimately improves recovery and energy levels. So, the impact on athletic performance is more psychological than physiological. This is a big one. Many believe that frequent ejaculation reduces the risk of prostate cancer and benign prostate hyperplasia, or BPH. A large study from Harvard involving 30,000 men found that those who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less than 7 times per month. While this doesn't mean abstinence directly causes prostate issues, it does suggest that regular ejaculation helps maintain prostate health by flushing out toxins and reducing inflammation. There is a common belief that abstaining from ejaculation increases the chances of conceiving a girl. A study analyzed sperm samples before and after 10 days of abstinence and found a 2% increase in X chromosomes, which produce female offspring, compared to Y chromosomes, which produce male offspring. While this is statistically significant, it's not enough to rely on abstinence alone as a method for gender selection. Sexually transmitted infections, or STIs, naturally decrease with less sexual activity. However, urinary tract infections, or UTIs, are a different story. Women can still experience UTIs even without sex due to their anatomy. E. coli bacteria from the anal region can migrate to the urinary tract. For men, UTIs are more commonly linked to sexual activity, so abstinence significantly lowers their risk. Abstinence affects everyone differently. Some men experience increased energy and mental clarity, while others feel more irritable or disconnected. The key takeaway is balance. Too much or too little sexual activity can have both positive and negative effects on your health. So, whether you choose abstinence for personal, religious, or health reasons, understanding how it affects your body helps you make informed decisions. Now I want to hear from you. What part of this surprised you the most? Drop a comment below and let's keep the conversation going. If you found this video helpful, give it a like and subscribe for more insights on intimacy and health. Thanks for watching.